transparent so the American people can have every confidence that any approved vaccine is safe and effective. At the same time, it's clear that this vaccine, even if approved, will not be widely available for many months yet to come. The challenge before us right now is still immense and growing. And although we are not in office yet, I'm just laying out what we expect to do and hope can be done, some of it between now and the time we are sworn in. But so the purpose of this is to let you know what we're going to do once sworn in. And so there's a need for bold action to fight this pandemic. We're still facing a very dark winter. There are now nearly 10 million COVID cases in the United States. And last week, we topped 120,000 new cases on multiple successive days. Infection rates are going up, hospitalizations are going up, deaths are going up. This crisis claimed nearly 1,000 American lives a day, and nearly 240,000 deaths so far. The projections still indicate we could lose 200,000 more lives in the coming months before a vaccine can be made widely available. So we can't forego the important work that needs to be done between now and then to get our country through the worst wave yet in this pandemic, to reduce the spread, to save lives. So that's why today I've named a COVID-19 Transition Advisory Board comprised of distinguished public health experts to help our transition team translate the Biden-Harris COVID-19 plan into action, a blueprint that we can put in place as soon as Kamala and I are sworn in to office on January 20th, 2021. And we'll seek to add other members to this board during this bring additional important perspectives on public health and expertise throughout the transition. This group will advise on detailed plans built on a bedrock of science and to keep compassion, empathy, and care for every American at its core, making rapid testing widely available, more widely available, much more widely available, and building a core of contact tracers who will track and curb this disease while we prioritize getting vaccines first to the most at-risk populations. Developing clear and detailed guidance and providing the necessary resources for small businesses, schools, child care centers to reopen and operate safely and effectively during the pandemic, protecting both workers and the public. Scaling up productive life-saving treatments and therapeutics, and when it's ready, making sure an approved vaccine is distributed equitably and efficiently and free for every American. With cases rising once more, it's imperative that we ramp up our production of personal protective equipment to make sure our brave healthcare workers have what they need to do battle safely against this virus. We're going to get states, cities, and tribes the tests and the supplies they need. We're going to protect vulnerable populations who are at risk, most at risk from this virus, older Americans and those with pre-existing conditions. We're going to address the health and economic disparities that mean this virus is hitting the Black, Latino, Asian American, Pacific Islanders, Native American communities harder than white communities. Focusing on these communities is one of our priorities, not an afterthought. The bottom line, I will spare no effort to turn this pandemic around once we're sworn in on January 20th, to get our kids back to school safely, our businesses growing, and our economy running at full speed again, and to get an approved vaccine manufactured and distributed as quickly as possible to as many Americans as possible, free of charge. We'll follow the science. We'll follow the science. Let me say that again. And we'll adjust to new data when it comes in. And we'll listen and work in cooperation with governors and local leaders of both parties who are fighting this virus in their communities this very day. There is so much good work happening at state and local levels across the country. Governors, mayors, they're stepping up. The advisory board will listen and learn lessons from their experience. And because we know that we won't fully defeat COVID-19 until we defeat it everywhere, my advisory council also includes experts on global health security so that we can restore U.S. global leadership to fight this pandemic. This is a crisis that affects everyone, As I've said throughout this campaign, I will be a president for every American. This election is over. It's time to put aside the partisanship and the rhetoric that designed to demonize one another. It's time to end the politicization of basic, responsible public health steps like mask wearing and social distancing. We have to come together to heal the soul of this country so that we can effectively address this crisis as one country where hardworking Americans have each other's backs and we're united in our shared goal, defeating this virus. As we work toward a safe and effective vaccine, we know the single most effective thing we can do to stop the spread of COVID is wear a mask. The head of the CDC warned this fall that for the foreseeable future, a mask remains the most potent weapon against the virus. Today's news does not change that urgent reality. I won't be president until January 20th, but my message today is to everyone is this: it doesn't matter who you voted for, whether you where you stood before Election Day. It doesn't matter your party, your point of view. We can save tens of thousands of lives if everyone would just wear a mask for the next few months. Not Democrat or Republican lives, American lives. You know, maybe we'd save the life of a person who stocks the shelf at your local grocery store. Maybe it saves the life of a member of your place of worship. Maybe it saves the lives of one of your children's teachers. Maybe it saves your life. So please, I implore you, wear a mask. Do it for yourself. Do it for your neighbor. A mask is not a political statement, but it is a good way to start pulling the country together. I want to be very clear. The goal of mask wearing is not to make your life less comfortable. It's to take something away from you. It's to give something back to all of us, a normal life. The goal is to get back to normal as fast as possible. And masks are critical in doing that. It won't be forever, but that's how we'll get our nation back up to speed economically, so we can go back to celebrating birthdays and holidays together, so we can attend sporting events together, so we can get back to the lives and connections we shared before the pandemic. It doesn't matter whether or not we always agree with one another. It doesn't matter who you voted for. We are Americans and our country is under threat. And now we're now called to do the same thing that generations of proud Americans have done when faced with a crisis throughout our history. Rise above our differences to defend the strength and the vitality of our nation. You know, that's the character of patriots. That's the character of Americans. We have to do this together. Wearing a mask may seem like a small act. Maybe you think your individual choice won't make any difference. But throughout the history of our nation, we've seen over and over how small acts add up to enormous achievements. It's the weight of many small acts together that bend the arc of history. You know, I know there's nothing the American people can't accomplish when we work together as one people with one mission. We can get this virus under control, I promise you. We can rebuild our economy back better than it was before. We can address race-based disparities that damage our country. It's in our power. So let's wear a mask. Let's get to work. Thank you. May God bless you. And for all those who've lost somebody, our heart goes out to you. We know what it's like. Our heart goes out to you. May God protect our health workers and our health care workers and all Americans. Thank you.
President-elect Joe Biden taking no questions there. He does not have the authority of president right now, but he does have the megaphone, and he has used it to announce his transition advisory board on the issue of coronavirus, also imploring Americans to wear masks as a symbol of unity and a symbol of a change in this country. Let's go to Jeff Bennett right now, who is following all these events. Jeff, what more can you tell us about this advisory board and how much the president-elect can do at this moment?
Yeah, Lester, it's interesting to hear the president-elect say that his transition and future administration will follow the science as it relates to confronting this coronavirus crisis. And to put his comments into context, this is precisely what public health experts have been calling for the last 8-9 months of this pandemic, a national COVID strategy to include a national mask mandate. You heard the president-elect say that he would work with governors and mayors to encourage mask wearing at the local level, not one, just because it's effective, but two, he said, because that will be the thing that will allow the country to return to normal as quickly as possible. He also called for a national contact tracing strategy and a plan to account for the equitable distribution of a vaccine. And he spoke at length about the racial disparity and not just the COVID infection rate, but also the COVID death rate, and explained why that's important. So on this first full day of a Biden transition, he is focusing his attention on the pandemic. That will, of course, be the top issue, and also the economic recovery that he faces when he is sworn in on January 20th, Lester.
All right, Jeff, thanks very much. I want to bring in our medical correspondent, Dr. John Torres. John, a lot of numbers to talk about today. 100,000 plus cases in the last 24 hours, 239,000 plus deaths, and now 90% is the number we're learning. That's the apparent effectiveness of this vaccine that Pfizer is producing. What can you tell us about that?
And Lester, President-elect Biden actually mentioned that at the beginning. He didn't mention it by name, but he's talked about a vaccine that looks like it's doing very well, and that's the Pfizer vaccine. We just got information from them on preliminary data that it looks like this one has 90% efficacy, which means that when they gave it to people, those that got the vaccine were much, much less likely to develop COVID or COVID symptoms. And that's great news, because a lot of experts were looking at around 50% or so for the efficacy. FDA said that's what they needed for emergency use authorization. This is much higher than that. This puts it in the range of some of the other vaccines we have, measles, smallpox, those vaccines that we know are very effective. And this can go a long way towards ending the pandemic, but it's not going to do it by itself. And President-elect Biden actually brought up time and time again that this is one of the most important things we can have out there, one of the most important public health measures. And it's not a political statement. It's something we need to do in order to get things under control. And for me, and I know a lot of my public health compatriots across the country, I think are breathing a sigh of relief, because the one thing he did say is we're going to follow the science, but we're also going to change based on the data. And we know since the beginning of the pandemic, we have information that has changed. We need to change along with that, because we're learning things as we go. This is still a new virus, Lester, and we're still in the middle of the pandemic, and we still have a ways to go.
All right, Dr. Torres, thanks. The markets today reacting to Joe Biden's victory and the news of the apparent progress on that vaccine. Let's get more on that now from senior business correspondent Stephanie Ruhle. Stephanie, good morning.
Good morning, Lester. Both very good news for the markets. Let's start with Pfizer. For the markets, the idea that this vaccine is on the horizon is a huge win, not just for Pfizer and biotech companies, but think about all the industries that have been hurt the hardest. We've got 27 million Americans that work in industries that are close contact industries. So things like travel, leisure, restaurant business, those industries are surging today, and it's going to impact business investment and business spending. That's a positive. Now let's go to politics. Yes, the markets are up because we do have a clear winner, but it goes directly to the remarks that we just heard from President-elect Biden. What he said is exactly what big and small business have been asking for. For months, Fortune 500 CEOs have been saying, we need massive contact tracing. We need rapid test results. That's how they're going to get their employees back to work. And for small businesses, the fact that President-elect Biden said we're going to give clear guidance to small businesses, to schools, to child care centers. Lester, you know, we've been telling these stories for months. Small businesses have just not known what are their reopening plans, what can they do. The fact that even though they didn't get details, but that we're going to get this national plan, that's a very big positive for big and small business.
All right, Stephanie Ruhle, thank you for that. For the latest on the Trump administration, let's go to White House correspondent Peter Alexander. Peter, what's the story there?
Lester, it's worth noting as we have this conversation about coronavirus that within the last half an hour or so, I confirmed from a spokesperson with the Department of Housing and Urban Development that its secretary, Ben Carson, has today tested positive for coronavirus. It's notable. Carson, of course, himself is a doctor. He was at that election night party that the president hosted here at the White House almost exactly a week ago, where most of the president's staff and other supporters were not wearing masks. We later learned that the president's chief of staff, Mark Meadows, tested positive, as well as at least 5 other staffers here at the White House. As for the vaccine itself, the president joined the chorus on this topic on Twitter in all caps, saying such great news. But his own son, Donald Trump Jr., cast some doubt on the timing here, saying that it appeared to be nefarious that it would happen almost a week after the election. It's worth noting that the CEO of Pfizer spoke publicly early today on CNBC, speaking to our colleagues, saying, among other things, that they were never working with the election as a timeline. Pfizer saying that they were working with the speed of science. Lester?
Peter Alexander at the White House. Thanks. Well, we're tuning you now to regular programming. I'm Lester Holt in New York. I'll see you later on NBC Nightly News. And, of course, we'll always come on as events warrant. Good day for now.